This is a presentation on Unit 16, Human Immunity by Emma Moore. During the presentation, I will discuss the following topics: the first and second line of defence, the third line of defence and acquired immunity, self-recognition and tolerance, specific immune system and disorders, categories of acquired immunity, the immune response to vaccinations, the concept of herd immunity, vaccination programmes and factors affecting vaccines uptake. Infection and invasions. In order to understand the body's defence system, we need to discuss how disease is caused and what causes it. Our immune system protects us from outside harmful microorganisms which cause infections. The four main types of infection causing microorganisms are bacteria, a single-celled organisms that are responsible for illness such as cellulitis, strep throat, urinary tract infections and tuberculosis. Viruses. These are smaller than bacteria and not technically alive themselves, relying entirely on finding a host for reproduction. They cause great many diseases which range widely in severity from colds to HIV or AIDS. Fungi. Fungi are responsible for many surface skin diseases, such as athlete's foot. Fungi can also cause infections to the lungs or nervous system. Parasites are the cause of conditions like malaria, which is transmitted by a mosquito bite. Other parasites may be transmitted to humans from animal feces. There are different methods that take place to help these germs transmit to the human body. The five main ways of transmissions are through the nose, eyes and mouth, things that our hands pick up. Our hands pick up all kinds of germs, so simply rubbing your eye could be a way of transmission. Another person sneezing or coughing near to you could also spread germs. And hand-to-food cross-contamination. The first line of defence is the skin. The skin is the largest organ our body has. The skin protects our body against harmful microorganisms entering our body and causing diseases and infection. This will continue to be an effective barrier against illness as long as it is not broken. The epidermis of the skin provides a waterproof barrier which prevents penetration of toxins, chemical irritants and microorganisms. Should the skin become broken through cuts or grazes, it starts to form a scab. The scab creates the temporary barrier as the skin underneath quickly heals. The conditions of the skin, the saltiness and the normal flora do not provide the correct environment for bacteria to thrive and grow. These are the innate defences. If the first line of defence is broken, the body's immunity system has a second line of defence. This consists of non-specific responses, and these are inflammation, fever, phagocytes, complement proteins, and cytokines. If the pathogen makes it into the body, the inflammatory disease begins. The immune system detects the pathogen and sends red blood cells to the affected area to increase the blood flow. The white blood cells in the area invade the infected tissue. These white blood cells are called phagocytes. They engulf and destroy the bacteria. During the inflammatory response, the infected area may become red, swollen and painful. When a pathogen has invaded the immune system, it can release chemicals. These chemicals cause a fever and increase the body's temperature. The raised temperature slows pathogens and can stop them from growing and help speed up the body's immune response. Once activated, the inflammatory line of defence will continue until the injury or infection has healed. Once the site of infection is healed, usually the skin will return back to normal. Pathogens and antigens. An antigen is the part of a pathogen that informs the body that it is under attack. If there is a threat to the body, it is capable of stimulating an immune response. Antigens are proteins that are found on the surface of a pathogen. Antigens are unique to each pathogen and inform the body of attack. Pathogens need the antigen in order to affect the body. An example of pathogen is tapeworm, athlete's foot and malaria. The third line of defence. If the pathogen is able to bypass the innate immune defence the adaptive immune defence is activated. This is the third line of defence. The cells in the body that belong there carry markers so they can be identified and the immune system will not attack them. These are called self cells. The immune system can recognise the pathogen as it carries no markers and is recognised non-self cell. Once the non-self cell is recognised, the immune system activates chemicals to attack it. The adaptive system is able to log that pathogen and remember it, so it can speed up the response if that pathogen enters again. Specific immune responses are triggered by antigens. Antigens are carried on pathogens. When the immune system senses an antigen, it attacks by producing cells that attack the pathogen directly. Antibodies are also produced, and the antibodies attach themselves to the antigens and attack cells which will destroy the pathogen by engulfing it. The main cells within the immune system are called lymphocytes. These are known as B cells and T cells. The difference between T and B cells are that T cells only recognise viral antigens outside the infective area and release chemicals known as cytokines, where B cells recognise the surface of antigens and of bacteria and viruses and make it easier for the immune cells to destroy the antigen. An efficient immune response protects against many diseases. An inefficient immune response allows disease to develop. Too much or too little or the wrong immune response can cause immune system disorders. Autoimmune disease are caused by overactive immune response. This can include transplant rejection, allergies and anaphylactics. Acquired immunity. There are two types of artificially acquired immunity which work rapidly so the person might not even know they have been affected, and these are actively acquired immunity and passively acquired immunity. Artificially acquired immunity is by human intervention, where passively acquired immunity is by natural exposure to a pathogen, but both lead to a memory being created by the white blood cells, and thus immunity is achieved. The key cells of the immune system are the white blood cells. These defend the body against infections and foreign bodies. T cells are the most common cells and are important in cell immunity. There are three types of T cells: cytotoxic, suppressor and helper T cells. T cells regulate immune functions, destruction of infected cells in the body, function through the release of certain substances and signalling B cells to be active. They activate cells that eat foreign substances to stimulate cytotoxic T cells and signal growth in cells. Suppressor cells are capable of suppressing the other T cells to prevent excess damage to the body's own tissue. They require the help of antigen-presenting cells to detect and break down foreign substances, then present parts to the T cells to start a response. The B cells are white blood cells which mature in the bone marrow and when activated release huge numbers of antibodies. B cells present antigens to the C cells to start activation. The two types of plasma cells which produce and secrete a single antibody directly into the circulatory system, where immunity continues for the duration that antibodies are secreted, and memory B cells which when not in action will migrate to the lymph nodes and where they remain ready to fight if that specific antigen strikes again. Immunoglobulins are antibodies made of glycoproteins that are bound to the antigens. They are critical in the immune response by the specifically recognising and binding to the particular antigens and aiding in their destruction. There are 5 different types. If immunoglobulin levels are high, it signifies disease, chronic illness, infection, or types of cancers. If levels are low, it signifies systems not working well, like kidney disease or diabetes. Self-recognition and tolerance. A transplant is the process of moving organs, cells, and tissue from one place to another to repair or replace damaged or disease. The immune system can be a barrier for this process. The immune system can reject the transplant as it sees the new cells, tissue or organ as foreign and can trigger a response that can destroy the new transplant. However, the immune system can be manipulated so that the transplant can be maintained and the risk of rejection is lower. It is vital that as close of a match as possible is made so the recipient's and donor's blood type, tissue type, and how the recipient's blood cells react to donors is tested thoroughly to find the best match. Immunosuppressive drugs are used to manipulate the immune system. These drugs prevent rejection by dampening the overall immune response. There can be side effects to the immunosuppressive drugs, and they can on some occasions leave patients susceptible to diseases. There are 3 types of rejection that can occur during a transplant, which are hyperacute rejection. This will happen instantly and the transplant must be removed immediately to prevent death. Acute rejection can occur any time up to 3 months after a transplant, and chronic rejection occurs slowly over many years, resulting in immune system damaging the transplant tissue and organ. Autoimmune diseases. Autoimmune diseases happen when the immune system mistakenly attacks part of the body. There are hundreds of autoimmune diseases, and 2 of these are multiple sclerosis and rheumatoid arthritis. Multiple sclerosis is caused by the immune system mistaking the myelin that protects the nerve fibres in CNS for foreign bodies, so destroys it. The types of this disease are relapsing, primary progressive, and secondary progressive. It is known to have the following symptoms. It affects vision, balance, memory, thinking, emotions, fatigue, numbness, tingling, spasms, pain, bowel and bladder problems. Once diagnosed, MS is lifelong. Usually the person with the disease is diagnosed in their 20s to 40s, and it affects 3 times more women than men. There are over 13,000 people living with MS in the UK. Usually the person notices symptoms years before the diagnosis. It cannot be cured, but medications, treatments and lifestyle change can help ease these symptoms. Rheumatoid arthritis is caused by the immune system mistakenly sending antibodies to the lining of the joints where they attack the tissue surrounding the joint, causing the thin layer of cells covering joints to become sore and inflamed, releasing chemicals that damages bones, ligaments, tendons and tissue. The 2 types of this disease are seropositive and seronegative. Rheumatoid arthritis is difficult to diagnose as many diseases have the same symptoms. A blood test can show indicators of the condition. A long-term condition that has flare-ups. More women than men tend to be affected, and it is believed that smoking increases the risk. Early diagnosis can reduce damage to the joints. It cannot be cured, but medications, treatments and lifestyle changes can help ease the symptoms, including surgery to correct joint problems. Joint pain, stiffness, swelling, redness, poor appetite, weight loss, sweating, high temperatures, lethargic, dry eyes, shape of joints changing, depression due to feelings of stress and anxiety from the difficult nature of the disease are symptoms of rheumatoid arthritis. Acquired immunity. Active immunity refers to the process of exposing the body to an antigen to generate an immune response. The response takes days, weeks to develop, but may be long-lasting. Active immunity is classified as natural or artificially acquired. Passive immunity refers to the process of providing antibodies to protect against infection. It gives immediate but short-lived protection. It is classified as natural passive, passed from mother to fetus or during breastfeeding, or artificially acquired. This is where antibodies are made by another person or animal and injected or transfused into somebody. Immunity and vaccinations. Immunology, memory, is the ability of the immune system to be able to respond to a pathogen that has previously entered the body. When a pathogen enters the body, it takes time for the cells to find appropriate antibodies to begin tackling the pathogen. This can allow time for infection to take hold and begin causing symptoms. To create a quicker immune response, memory cells are released with a new pathogen is found, meaning that the pathogen enters the body again. It will have remembered, so antibodies can be produced quicker and more efficiently. A vaccination releases a weakened or harmless form of the pathogen, exposing the body's immune system to the infection or disease. There are many different types of vaccine, either live or inactive. Inactive vaccines usually take multiple doses in order to work. The first dose does not always give immunity, but the second dosage does. Live vaccines are made from viruses or bacteria and weakened in the lab before being injected or ingested into the person where the vaccine replicates in the person and stimulates the immune response. The dose is low, so won't cause the disease, and is received and responded by the body in the same way it would if acquired naturally. The benefits of vaccinations are they extend life expectancy, protect against disease. Some diseases have been completely eradicated as a result. Smallpox, for example, in 1979. Viral diseases can't be cured with antibodies, but can be controlled by immunisation. Vaccines make huge savings in healthcare and have been known to be able to prevent cancers. Herd immunity. In the past, measles, polio and whooping cough would take the lives of many young children prior to vaccines being introduced. These diseases are still in existence, but with far fewer cases. If we look at the history of measles according to the Public Health in England and focus on periods of 10 years, you can see that there has been a decline in numbers over the years, and especially around 1968 when a vaccination was first found, and then again in 1988 when the vaccine was introduced as an MMR childhood booster. And now more recently, with only 9 deaths in the 10 years between 2006 and 2016, there was an increase in 2017 to 284 cases, and again to 991 in 2018. Just as the WHO was about to declare the UK as being measles free. Between 1980 and 1988, prior to the vaccination, deaths from measles were seen in all age groups, whereas after 1988, the introduction of the childhood MMR vaccination, there were hardly any deaths in the younger age groups, and a few in over 15's category who would have missed out on the MMR booster when immunity is where contagious disease is spread from person to person. If a lot of the population is vaccinated against a specific disease, it is harder for the spread to happen. This offers protection to the weaker members of the herd, like the sick, frail, old, and very young. The WHO recommends that 95% of the population should have the vaccination to allow herd immunity to occur. To encourage people to vaccinate their children, it is important to make receiving them as convenient as possible by having a set out pattern to receive them and recording a vaccination record book, as well as having a variety of places where a person can receive them, from pharmacies, GPs and schools. It makes it easier for parents to work with the programme. Factors that affect vaccine uptake are: part of the explanation may be complacency, from people thinking that the disease is now eradicated and less of a threat, so they don't think the vaccination is necessary. A controversial belief is that Andrew Wakefield wrongly linked MMR to autism, which led a drop in numbers of children having the vaccination. Misinformation spread by the anti-vax movement. Measles must be eliminated globally, or we will continue to have spikes as unvaccinated people enter the UK or people travel to infected areas. There were 600 deaths in the Democratic Republic of Congo in 2019 due to measles. Thank you for taking the time to listen to my presentation.